You're welcome to Reproductive Health segment with Dr. Ajayi. My name is Dr. Ajayi. And you know the year is fast coming to an end, and we're trying to wrap up everything. And even on this program, we're trying to wrap up some of the loose ends and dot the I's and cross the T's. So today we're in the laboratory and we're going to be talking with an embryologist. So brace yourself up. Most of the things you're going to be hearing today will be about the embryo. With me on the program is now Mr. Paul Faduola. Paul, you're welcome to the program.
Thank you very much.
Very good. Paul, we're going to be looking at some of the questions that we get asked all the time. And one of the first ones is that patients ask these questions. Can I see my embryos? Paul, can people see their embryos?
Yes, they can. Now, that decision depends on the way the treatment is going. If a patient is on a day 3 transfer, we'll let them see their embryos. The instance where we'll not allow patients to see their embryos is if we are taking those embryos to blastocyst stage, or we are offering them assisted hatching on their embryos. At this stage, the embryos are very fragile. So we tend to expose them to minimal amount of light. So in this instance, we are not going to let them see their embryos, but we'll try to explain to them the reason why we are not letting them see the embryos.
Okay. Now, one other question that we get asked is, as a patient, how can I know if my embryos are doing well?
Yes, that is a good question because many patients tend to ask this same question. We actually talk to the patient a day after aspiration, the egg retrieval. We inform them how their embryos are doing. Usually, on the day after retrieval, after we inseminate their eggs, they get fertilized a day after. If we see 2 pronuclei in those embryos, we call them pronucleate embryo. We inform the patient the number of the embryos that became pronucleate the day after the aspiration. Based on this number and the number of egg retrieved, she can have an insight of how the cleavage, the fertilization rate is. Now, 2 days after, that is the following day after the eggs we retrieved became pronucleate, we expect the pronucleate embryo to now cleave. If they do cleave, that means the embryo is actually moving, it's actually developing. We look for certain features like fragmentation, which we report. These are indications that the embryos are not actually doing fine, but we rarely get them in our laboratory. So these are few things that a patient will need to know or will know when our embryos are not doing fine. The formation of fragmentation or fragments, and maybe when the embryos are not cleaving. In this way, she gets to know that embryos are not doing fine.
Okay. Well, cleaving means they are dividing.
They are dividing.
Okay. So now, when should embryo transfer be done from your experience?
Well, over the last 2 decades, majority of the embryo transfer, or majority of the babies that have been born through IVF, the embryos were transferred either on day 1, 2, or 3. This is because the culture media that we are used within those periods will not actually support the development of blastocysts.
What are blastocysts, if I may ask?
Blastocysts are day 5 embryos. They are embryos that are the point of hatching and implanting into the uterus of the mother. So usually that is the highest grade of embryo that we can develop in the laboratory. So with newer culture media and technology, we're able to culture embryo to day 5. But before now, embryo have been transferred on day 1, day 2, day 3. So the choice of the day of transfer for a patient is usually dependent on the way the treatment is going. We consider the age of the mother that will be carrying those embryos. We consider the number of embryos that we have in our treatment. And we also consider the rate of development of these embryos. So these are factors we put into consideration when we are doing when we are deciding the day to do embryo transfer.
Well, you mentioned something that I want to ask you about. How do you determine the best embryos to transfer? How do you make up your mind on what embryos to transfer? For instance, a patient has 8 embryos. How do you determine the best to transfer?
Usually that decision is usually taken based on the pattern of cleavage of the embryos. We start taking into consideration the embryos to transfer from day 1 when the egg gets fertilized. The position of the pronuclear will determine if it will develop into a very good embryo or not. The rate of cleavage or division of the embryos is another factor we consider. Not only the rate of development, the size of the blastomeres in the embryos, we also put that into consideration when deciding the number of and the best embryo to transfer. Now, on a day 3, the best embryo for transfer are embryos that achieve the 8-cell stage. Now, we check the pool of the embryo. Those that achieve the 8-cell stage, if they are less than 5, we select a certain number based on the age of the woman. But if we discover that she has a pool of 8 cells that are looking very good, we might not be able to tell the ones that we actually implant. So in that case, we have to move the transfer date to a day 5. We have the embryos. Most likely, if we have 5 embryos, for example, on a day 3 that are 8-cell stage, they may all be having the same physiology, and we cannot be able to tell the one that we implant. So, but by day 4, some of them will be compacting, while others will become morula. On day 5, out of that 5, it might be only 2 or 3 that may achieve the blastocyst stage. So that 3 that achieve the blastocyst stage are the best embryo for transfer on that day.
How do you determine the number that you transfer? Do you determine, is there a number, cutoff number?
Yes. The cutoff number for transfer will depend on the age of the person we are transferring it to. Okay. We tend to transfer fewer embryos to younger women.
Why?
Because the rate of implantation is higher in younger women than in older women. So we tend, but at a maximum, we don't transfer more than 4 embryos to older women. But younger women will transfer 3 downward, depending on the age.
Okay. Paul, one thing I want to ask is, can I insist on a day 5 transfer?
I will actually want the patient to leave that decision to the physician and the embryologist taking care of the embryos. They are able, the essence of doing a day 3 or a day 5 transfer is to synchronize the embryo stage and the female track, the female reproductive track. If the embryologists think that taking that embryo to day 5 or taking that embryo to day 5 will not bring out an optimal result for the woman, she is not likely to take, they are not likely to take it to a day 5 transfer. And if she insists, it might not be for her benefit. Okay.
Yeah, thank you very much, Paul. I'm sure our viewers have been educated on what happens to the embryos in the laboratory and what to ask for, so that you are not asking for what is not possible.
Yes.
Thank you for coming to the program.
Thank you
and
very much.
You know what? I'll see you next year. Stay tuned.